And this is News Talk 93.9 and 910 WSBA, and we are honored this morning to have with us Pam Gay, who is a York County Coroner. We've heard an awful lot this week about death statistics during this COVID-19 virus, and some of the coroners having some questions about that, and the chain of command and chain of communication, I guess, is what we're looking at. And we welcome Pam to the show. Good morning, Pam. How are you?
Good morning. Great. How are you doing, Gary?
Oh, good. It's always good to have you on this show. And, you know, one of the news stories this past week was, I guess one of the coroners, or a number of coroners, had questioned some of the numbers by the Secretary of Health regarding this jump that we had, where they were kind of catching up on some of the, I guess, some of the numbers they thought they had out there. I saw in York, for example, it jumped from 6 to 13. I think it was Franklin County that went from 0 to 10. And, you know, a lot of people say, wait a second, you know, what's going on here? I wanted to get your take this morning on, have the coroners been kept in the loop so far in terms of all this, or are we still adjusting with, you know, new information or latent information? Tell us a little bit from your perspective.
Well, locally, I will tell you that the hospitals have been really good about reporting these deaths to us, as have we've gotten the word out to nursing homes and hospices. And I'm hoping that they are also, many of them are reporting to us on every death right now of nursing homes, because we want to keep a track of, you know, obviously if there's an uptick in deaths that seem to be natural, we want to make sure that we're not missing anything.
Sure.
And so far, all that's been working really well with the facilities in our area in York County. So I'm very happy to say that, you know, everybody's been cooperating to the, you know, the extent that I can see anyway at this point.
Sure.
And we set that up actually early on with the hospitals, and then shortly after with the nursing homes and hospices and assisted living. So where the discrepancy seems to be is the Department of Health. We've been told recently that they're actually using numbers that are for presumed or also, you know, not totally confirmed positives. I think now they're changing some things with that. I don't know if you noticed yesterday, but the numbers dropped
I did.
from 13 to 7. I technically have 5 deaths reported to me at this point. I will tell you that from our facilities in York County. But
Right.
I also understand now, and this I hear from other entities who are working with the Department of Health. I haven't heard it directly from them yet, and I think the coroners would really like to hear all that directly from them and have some interaction with them to clarify. But the other thing that's happening is I think if there's an individual from York County who dies in a hospital in another county, they're actually counting that as a York County death, I believe. Again, I haven't heard that directly from them. I'm thinking, I mean, that's what they're saying at these press conferences. And I initially heard that from the hospital entities that I work with. So that's where the discrepancy seems to be. And while I certainly understand, you know, the public health aspect of that, as a nurse, I understand how important it is to kind of know where they were living, where they were residing, that kind of thing. But then we would like some clarification. Give us that difference. Like, show us that this data is because these folks were living in York but died in maybe Dauphin. Give us that data so that we have it. We don't have any of that.
Or let's suppose, for example, you had a person from York who was visiting New York City and died in New York City.
Right.
Well, okay, they died in a different situation, and yet they're from York. So therefore, they didn't die because they were in York. They died because they were where it was a hot spot in New York City, which is dying down a little bit right now. Poor choice of words, I'm sorry. But is coming down a little bit right now. And yet at the same time, where you are is really kind of part and parcel to all this, isn't it?
Yeah, and so that kind of goes opposite of what coroners do. I mean, you and I have talked about this before. You know, our jurisdiction is York County, so if there's a death in York County, it didn't matter where you were from. If you died in York County, it actually counted as a York County death, and we have jurisdiction over that decedent, that body, that situation.
Right.
If it's not a natural death that the doctor's going to sign off on. These are considered natural deaths, I'll say that. So that's some of the arguments that the Department of Health uses with their law. And our law actually says we get involved in those when it's a communicable disease. And they need to be reported to us. So they're saying that their law, I guess, trumps our law. I don't know. Their interpretation, that was back and forth for a while, that we're interpreting it incorrectly, our law. which is kind of bizarre because we've been through this with HIV/AIDS. We've been through this with Ebola. In the early days of HIV/AIDS, some of my coroner colleagues are telling me that those were reported to them initially too, and then eventually, when it wasn't so much as highly communicable as it was initially, they actually eased off on that, and now those deaths aren't reported to us. So I can certainly understand why that would phase out like that. I'm expecting, obviously, that when we get a vaccine, that we're not going to have all these deaths, to the extent, obviously, that we do now, and it won't be as communicable, and it won't be something that we need to be reported on every time, it has to be reported to us. But in the early stages, it helps us get a handle what's going on locally in our community. When we see numbers discrepancy like we have right now, thankfully mine aren't too extensively, different,
right.
but there are some counties where it was significantly different by many numbers.
Well, we saw like Lancaster the other day went from 66 to 88. Yeah.
Right. And so that, I think sometimes that brings about a little bit of distrust among the people. They want honesty. They want transparency. I certainly understand that. We're trying to get to a point where we can validate or justify that difference. And that's all we want. We just really want that information relayed to us so that we can explain, this is how many are confirmed to us from the facilities. This is how many died outside of York County but are York residents. So that's really what we're asking. I mean,
in other words, numbers. Yeah, the numbers ought to be the same across the board here, is what you're saying. I heard the question.
Clarify so that we know.
Right, I heard the question asked of Dr. Levine the other night regarding this, and she did say we're going to try to do a better job of communicating with the coroner. So it sounded like they kind of recognize that maybe communication there has not been as clear in what you're asking for as it should have been. About 40 seconds left in this segment, then we're going to do one more with you. But your thoughts?
I certainly appreciate that. I know that as of yesterday, that meeting or reaching out hasn't happened yet, but maybe I haven't looked at my emails yet this morning, so maybe that's in process. But we certainly think that would be helpful if we could just meet and discuss this. And I know our association president, Chuck Kiesling's been reaching out to him. I know Kerry Benenhoff, state representative, has been working, to try and, he's a former coroner himself, so he knows what we're going through, and he's been trying to represent us on this. So that would be good, obviously.
We'd like that to happen. When we come back, we're going to ask you about the changes that have taken place for you. WSBA Morning News with Gary Sutton, where it's 8:18. We're with the York County Coroner, Pam Gay. And we've got a question from Sharon in Brogue for the coroner. Good morning, Sharon. You're talking with Pam Gay this morning. How are you, Sharon?
I'm fine, thank you. Good morning, Pam. I have a question about how the deaths are counted as being from the virus. Like if there's a different immediate cause, like somebody's in an accident or whatever, and then do they still test them and say that they had the virus? If, the cause of death is what I'm questioning sometimes.
Question. If it would be an accidental death, we would be involved anyway. The coroner would be, and so we would have that as our primary cause. And then we would add that the COVID, there's a place on the death certificate where you could either add it to make it additional primary cause, or you can add it as contributing but not causing the main cause of death, basically, not being a factor in the main cause of death. So coroners do that already, and the doctors and hospitals can't sign off on anything that would be accidental, like a suicide, homicide, drug overdose, or that kind of death that would already involve the coroner. That has to be certified by the coroner. And we are not having COVID be the main cause of death without having those. In other words, if there's another factor involved that's accidental or suspicious, the coroner is going to put that down instead. So,
okay.
Hopefully that clarifies that. So the COVID that are being reported are generally, the ones that reported to me so far are all facility cases, and they are COVID only. So
did you have
I
any
don't
questions?
have any doubt about that.
Did you have any questions when you've heard of the Secretary? Again, I'm not casting any dispersion on the Secretary of Health, but when she said, well, we were starting to include, and that kind of backed off a little bit yesterday, we're starting to include, the indirect kind of deaths. In other words, they weren't tested as positive, but they were around someone who was positive, who died.
Yeah.
And so they started to say probable deaths as opposed to the actual thing you're talking about here.
Yeah, well, let me just say that probable is a term used on death certificates all the time. The coroner does it all the time, probable cardiac event, because sometimes we don't know for sure, but the medical evidence supports it. There's maybe tests that have been done, that kind of thing. And I do believe that there is probably an underreporting. I know that doesn't probably fly with some people, but we do believe that we're seeing a lot of type of illness that could possibly be COVID, but they don't meet the criteria to be tested, or maybe they, weren't able to be tested. And so I think that eventually some of those deaths, the medical experts are telling us, and the physicians in the hospital, there's a classic pneumonia that they're seeing. And I think if that classic pneumonia is seen and the test hasn't been done, or the test comes back negative, I think you can presume that was likely COVID. And this is a classic pneumonia that you don't see elsewhere. So certainly
So for people who got upset about that, For people who got upset about that, there is reason to believe that there are probable deaths out there. So that's good information this morning. Let me ask you from the standpoint of a person in the medical field a little bit. This idea of herd immunity, you've heard a lot of people, it's become kind of a political thing too, but the idea of herd immunity, that we ought to just let ourselves get sick and we'll get cured quicker and move on and all that. Where does that fit into your conversations and the information that goes around in your particular circles?
We want to see a lot more testing in our office. We would love to be able to, see a lot more testing of the general public, because I think probably there are some of us walking around who have that antibodies, have developed and have been exposed, and even probably had mild symptoms or no symptoms at all. And I think the more that we do that, we all agree in here, and a lot of my colleagues, that the more we do that, the more we're going to have a grip on how soon we can phase in these different areas of work that might involve, obviously, all of us doing a lot more social distancing initially. But as we learn that more and more of us are immune, then we can probably, likely ease off on some of those restrictions. I think that is definitely the way to go. That's sort of how viruses work, and it's infection control 101.
We're going to have a very quick question from Bill here before we go to a break, Pam. So let's get Bill in very quickly with your question. Bill, go ahead.
Okay, Pam, good morning. Pam, are we in a situation where in some of these where there's really a question that an autopsy has to be made to actually determine what the cause of death is?
Thank you, Bill.
If it's a good question. If it is a coroner's case that requires an autopsy, generally we're going to still do an autopsy, although I will say that, the OSHA is recommending to the forensic pathologist to really hold off on doing autopsies as much as possible if it's only COVID. So we are not sending them for autopsy if it's only COVID. However, if it's a drug overdose, if it's a homicide or something like that, we're still going to send them for autopsy. That's all going to continue as usual.
Pam, I really appreciate you taking time out of a pretty busy day here to be with us this morning. Thank you for some good information. Really appreciate it, and be safe.
Thank you. You too, everyone.